If you're already using minoxidil, finasteride, or IU-58841 and you are seeing absolutely no progress or even slow progress, this might be the missing link. Microneedling can dramatically boost your results, but only if you do it right. And that's why today I'll show you a science-backed method to use microneedling safely at home and how to avoid the most common mistakes so that you will get the maximum results at minimum risk. Microneedling, also known as collagen-inducing therapy, is a technique where multiple fine needles create controlled micro-injuries to the skin. It's been used for decades to treat acne scars, wrinkles, and even pigmentation. But now it is increasingly used to treat hair loss, especially androgenic alopecia. Why? Because the scalp responds to micro-injury by initiating a healing cascade. This process happens in 3 different stages. Stage 1, inflammation. After any kind of injury, your body will flood the area with signaling molecules, cytokines, and growth factors, calling a ton of immune cells to the area. Stage 2 is proliferation. This is when fibroblast creates collagen. New blood vessels form, and it's a process called angiogenesis, which is crucial for hair follicles and stem cells in the dermal papilla that hence gets activated. Stage 3 is remodeling, and this is when the scalp rebuilds its architecture, and with the right stimulus, hair follicles can recover thickness and density. In fact, we have good evidence for this. A landmark 2013 randomized trial by Druad compared minoxidil 5% twice daily to the same minoxidil combined with weekly microneedling. After 12 weeks, the microneedling group saw a 4-fold increase in hair counts compared to minoxidil alone, which obviously proves that minoxidil compared with microneedling does have a significant increase in effect. But here's the catch. Minoxidil does not create new hair follicles out of nowhere. Instead, it revives miniaturized hairs, vellus hairs, before they disappear completely. The aim is to thicken the shaft and prolong the growth, which is the anagen phase. Try and think of it like this. It's like a neglected plant. If the root is still alive, the right care can bring it back, but if it's been dead for too long, no treatment on earth will help it. That is why microneedling works best on thinning areas and not the completely bald ones. So when it comes to choosing the procedure you want to do, there's 2 ways of doing it. There's the professional and then there's the at-home microneedling. On top of that, there's several other ways to microneedling, and the method you choose does matter. But I will walk you quickly through them. In clinical settings, microneedling is often done with devices like dermapens or microstamps, which deliver precise needle depth, usually 1.0 to 1.5 millimeter, which is ideal for reaching the dermal papilla where follicle stem cells reside in. At home, most people use derma rollers, which is affordable and easy to find online. Typically, they range from 0.3 to 1.0 so far, what I've seen. And they're fairly effective, but they do come with their own caveats. The design of the roller can tuck or damage hair shaft if not used fairly carefully. It is also hard to maintain a consistent pressure, and the sterilization of it is often neglected because it's really hard to do, raising the risk of infection, which is just stupid. If you decide to go with the roller, I recommend starting conservatively using a 0.3 to 0.5 millimeter roller once every 1 to 2 weeks. That is enough to trigger healing without over-traumatizing the scalp. But honestly, I would never recommend a roller for anyone. I would always recommend that if you can afford it, go buy a dermapen, buy a few packs of needles, and go with the 1.0 depth for 10 minutes once a week, or maybe once every other week, and stick with that. If you live in the US, I can recommend buying the dermapen from Derek for more plates, more dates. This is company intelligent, and I have a discount code in the description if you want to check that out. But if you live in Europe, I would recommend buying the Dr. pen, since with taxes and shipping, Derek's pen just becomes a little bit too expensive for me, and I recommend you guys in Europe just, save some money for other stuff. And of course, after each use, make sure to clean it. Always clean the device with 70% isopropyl alcohol before and after each use. An infected scalp won't grow any hair, it'll lose even more, so don't make it work against you. Microneedling as a monotherapy can be effective, but It is when it's combined with other treatments that it'll literally blow your dick off.
Oh, you see that? His dick flying off.
For instance, the same 2013 study I mentioned earlier found that microneedling supercharged the result of topical minoxidil. And more recently, a 2020 study found that combining microneedling with topical finasteride improved hair count significantly, more than finasteride alone, more than double the effect also, to be precise. Another option is PRP, which is platelet-rich plasma. In-office microneedling is often combined with PRP injections to enhance the regenerative effect, and some doctors even apply topical dutasteride or finasteride during microneedling to deliver the medication directly to the follicles. Just be aware, most liquid minoxidil formulations contain alcohol and propylene glycol, both of which can irritate the scalp after microneedling. I recently also made a video regarding RU58841 where I spoke shortly about how ethanol and too high concentrations of ethanol can push the RU58841 into the bloodstream, so just be careful with these kind of things when you're combining them. And if you are applying any topical post-treatment, just wait 12 to 24 hours and opt for the gentler foam versions if you can find them and they're available. And while we're touching on cautions, this treatment is not risk-free. Overuse, especially with the long needles, can cause chronic inflammation, fibrosis, or even scarring. That is why less is more, especially in the beginning. Be careful and get familiar with the tool. Rather start out super slow and make sure you did not by mistake set it to like 1.5 instead of 0.5 before you go completely nuts. Some people also experience shedding after starting microneedling. Don't panic. It is often a temporary phase where the weak hair will fall out, making room for stronger regrowth. It is a natural process. Don't stop if you experience shedding. Just keep on going. It will pass and it will get way better. Also, be gentle. If you're using retinoids, acidic products, or chemical exfoliants, stop them at least a week before microneedling. The scalp needs to be calm, not inflamed before you start. We already talked about inflammation. And finally, remember, scalp skin thins with age and with hair loss, especially with hair loss. That means that what works for someone else might not work for you. Hence, again, don't jump straight into 1.5 millimeters just because some Reddit thread said it helps somebody. Microneedling is one of the most promising non-surgical options for hair restoration, and when used properly and combined with smart topical or oral routines, it can significantly improve results. But it is not a miracle, it's a stimulus. And like any other stimulus, consistency and moderation and proper technique are what makes this work, not just the device itself. So if you're thinking about starting, start small, stay clean, and be patient. Just keep going. It takes forever, but you will get there at some point. And of course, if you want me to talk you through a beginner-friendly routine or compare specific devices, just let me know in the comment and I'll look into that. Thank you for watching, and I'll see you in the next one.